I'd like to thank everyone for joining us on this week's webinar. Happy Friday to everyone. And with that, we will go ahead and jump right in with Val.
Good morning, everybody. Thanks for joining us. I think we're going to start with some numbers first today. So I just wanted to kind of give you guys an update on cases in the community. These are case totals from our community providers. We've had 45 cases. We only keep track, count, not that they don't count, but we're only counting cases where individuals are positive. So we know we've got a lot of providers with positive staff also. We have not been keeping track of that, but do want you to know if you have a positive staff, that triggers an outbreak testing. And so please let us know if you have one so that we can help facilitate that outbreak testing for you. But these are just individuals, and as of this week, yesterday, we had 45 individuals that are supported through any one of our DD waivers or DD services that had COVID positive, and we've had 3 deaths. On the state-operated side, we've also had 3 deaths. So I just wanted to make sure people know we're still counting and this is still happening. We had a new outbreak yesterday that occurred in a group home in the state, and mobilizing really quickly to work with those folks. Those folks are doing a great job. Our staff are doing a great job. Local public health agency there is doing a great job. But just wanted to make sure that everybody's aware this is still going on, and we're still responding daily to needs and those kind of things. Other kind of sad, definitely sad news, and I've been sad for a couple days because of this. We did lose our first state employee for the Department of Mental Health this week. It was a team member that worked at South County DDTC. That employee was young. That employee leaves behind a young son and a husband. That employee had been with us for 13 years and was not only a part of our DMH family, but definitely an intimate part of our DDTC family. So she'd been in the hospital since March 28th, and it's a horrible way. It's a horrible way to end a life, and there's no way to say goodbye. So I just wanted to make sure that you are continually to think about the impacts of COVID-19. I know the governor yesterday announced that there will be no more health restrictions at the state level. That does not mean there won't be local health restrictions starting on Tuesday, but that they are lifting all those state level health restrictions. We are still under a state of emergency in the state of Missouri, and they extended that all the way to the end of December. So there's some things that we're able to do as under a state of emergency, like waive some of our rules, and that still continues. We will be reevaluating that. We don't have to waive rules. We're allowed to. So as we watch the numbers and we monitor the trends and we get a better feel of how this is going to progress, we can make decisions on that. But that has been extended till December 30th of 2020. So it's something we don't have to talk about anymore because it's taken care of, which is nice. I do want to let's talk about the governor's announcement yesterday. So the state is open. That means there, again, are no state level health restrictions starting on Tuesday. That does not mean that there's not local restrictions, so you still need to be working with your local governments. That also doesn't mean that we don't continue to do what we've been doing all along, because prevention is still the key, and the governor made that clear yesterday. It's still really, really important that if you wear masks, if you're going to be in places where you cannot socially distance yourself, it's still really, really important to make sure that social distancing is in place. All of these CDC guidelines are still in place of what we should be doing to prevent the spread of COVID-19. You should still be screening your staff and residents on a regular basis to make sure that, and individuals that you support, to make sure that you know what their condition is. And you should still be very vigilant about your surface and your hand hygiene, because those things are very important. I am going to preach prevention. We've been preaching it all along. That's not going to stop. We're going to continue to preach prevention and all those things that we've been doing. 45 cases is good. That's good in the community. We serve a lot of people to only have 45 at this point. But we have to continue to preach this prevention. The other thing I'm going to continue to preach is testing. And this week, we actually did our first round of community testing with a provider not related to an outbreak necessarily, but at the provider's request. I know as of yesterday, we had 300 of those test results back with 2 asymptomatic staff or 2 positive staff found. One of those staff was an asymptomatic staff. One of those staff had been negative, but had now been positive, tested negative, and now has tested positive again. So working with that agency on plans and how to proceed, but that's why we do the testing. If 1 out of 300 means we have limited the exposure for that individual's family. We've limited that individual's exposure to our other teammates and staff members, and we've limited that individual's exposure to the people we support. And that just goes out, further. And I can tell you on the state side, our employees appreciate the testing because they know they're working with vulnerable people. They know that they have lives outside of work, and this takes away the guilt. This raises their confidence. They also live with people that are vulnerable. They support other people that are vulnerable. So everything we can do to make them more confident in doing their job is another reason why this testing is so important. I know we have a lot more providers going next week, and we'll kind of keep you guys updated on those results. Thank you to everybody who has stepped forward early on to help us get this started. You know, it's not always fun to be the guinea pig, and you learn a lot in that process, but I do appreciate those providers that have been working with us in these early stages to kind of get this up and running across the state, because it's going to be different everywhere we're at. And I know there's you're going to learn a lot in the process. And this first round of testing is really just first round, because after that, it's really important that you keep some sort of testing rhythm so that you have an idea about your agency and the folks that you support. And that testing rhythm is what we really call that sentinel testing. That's where you're doing surveillance, but it's not on everybody, but it gives you a better idea of where you are as an agency. And that's what we will be starting up with the state this week, is surveillance testing at all of our facilities. We'll be doing 10% of our population and 10% of our residents and 10% of our staff mixed together every week until August. During that process, we'll be evaluating if we should be doing more testing because of what's going on in the community around us or less testing. We're also going to start working with our staff on some incentive-based testing. So we recognize and we want our staff to have lives, because this work is hard and they need to have breaks and they need to be able to go to family weddings and they need to not feel guilty about it when they come back. But if they want a test, we're working on a way to establish an ability for them to get a test, not outside of that surveillance testing, but just because they're like, you know what, I think I probably should have a test. I think you better check me out. So, and so we're going to work on doing that as well. So just, you know, it's really important that we support our staff as much as we support the people that I'm paying you to support. So, and that this testing really gives us that opportunity. Budget update, I don't have any update really at this point. The federal, I do have this, the federal government, and we will get help get some additional guidance out about this next week for sure. But the federal government has opened up some provider relief funding for Medicaid-only providers who have not gotten any of the other provider relief funding, which none of our providers, based on what I have seen, have been able to access any of that other provider relief funding. So it's an opportunity for providers to, it's based off of your Medicaid billables, and it's an opportunity for providers to get up to 2% of that just to you in the form of a check. So you do have to go online and fill out a application, so to speak. But that money is there. I'm not sure how long it will take to process that. There's some attestations that you have to go through. There's more and more information coming out about it all the time. This was announced on Tuesday. Today is Friday. I know the national associations and the state associations, MARF and MAC, are looking at this really closely and trying to get their members up to speed on how to apply for this. And we will make sure that our provider relations staff push that out to everybody next week also. We're just trying to get as much information as we can beforehand. This is not state money, so this has nothing to do with us. We can't help you fill out the application. You've got to do that on your own, but we do want to make sure you know where that is. I believe you've got until July 3rd to do it, so there's a couple weeks here for you guys to get that done. But it's an opportunity for you to get part of that $15 billion with a B, set aside across the country for Medicaid-only providers because Congress passed this and HHS recognizes that all Medicaid providers are suffering right now. So anyway, to make sure you guys were aware of that. Questions. Okay, so there was a question. Where is it? It is said that the new COVID-19 measures are effective the rest of the year or well into 2021. Is this correct? So I kind of think I just addressed that. So the CDC has not backed down on the importance of social distancing. And I'm going to say it again because I'm going to preach prevention, and that's how you do it, right? The CDC has not said that we should not social distance. The CDC has not said that masks aren't important. The CDC has not said that you can quit washing your hands and start picking your nose. Don't do those things. All those things are still very, very, very important. So, again, we've learned a lot over the last 3 months about what we're personally comfortable with, what we see to be effective, and those are the things, if we take what we learn and we can each have that personal and individual responsibility around this and do our best, then we help mitigate the spread of COVID-19. We are not going to stop it. It is going to continue to spread. We do not have control over that, and we know that very, very well. I was actually on a radio interview yesterday, and they asked, why did I think more employees at South County had COVID than at my other facilities? And I said, I wish I knew the answer to that question, because if I did, I could stop this from spreading. But there's still so much we don't know, but what we do know, we really, really need to be vigilant about practicing. Is DMH still allowing an agency to limit outings and activities during this time? That is an agency and an individual decision, and we're going to keep pushing back to you with an individual and agency decision. Every situation is unique and different. What I'm looking, I'll just tell you what we're looking at is we're looking in the facilities. Is there a way that I can allow more movement maybe within the facility, but probably still limiting that outside access depending on where you're at in the state? I also, though, have federal guidance that I will have to follow. And while we don't have to follow that guidance on the waiver side, it is good to look to that guidance to help you make your decisions. Another really cool tool that's going to be coming out next week, and I think it's next Wednesday, the Missouri Hospital Association, in conjunction with the states, has put together some really cool regional dashboards. Mm-hmm. So we will share those regional dashboards with you next week, and that'll also give you another tool as you're trying to make decisions about what's best for your agency, where you're at, and the people that you support. We've got a lot of really, really healthy people that have already re-engaged the community and are successful at it, and we're glad to see that, and we want more of that. But we also know that we care for a lot of really, really vulnerable people, and we want to make sure we can do everything we can to protect them and the staff that's supporting them. So will the agency be penalized since individuals were home because of not working and or the staffing was short due to exposure purposes? No. I'm looking at Wendy. It's a tricky question to answer. The answer is no, I think. I don't know why I think it's tricky, but I do. Again, this is an individual-based service that we provide. So, you cannot be penalized because you said that people could not go out. That was a national decision as much as it was a statewide decision. As health orders are being lifted, it's really an individual, again, it's an individual-based decision. I have an 82-year-old mother-in-law. She's not running around town right now. Even though she knows she can and she knows that that's acceptable, it's not the right decision for her. So I would go ahead and stick with that. And yeah.
I would just add that, be sure that you're documenting if you've got changes from your staffing patterns, if you've made changes in your staffing patterns because a staff person moved in to live with folks for a period of time, or you didn't need the one-on-one staff because you weren't going out into the community, and so there were changes and those kinds of staffing changes, or maybe you were just short-staffed, staff got sick and you were running short. Just be sure to document what the circumstances were and have that on hand, and
everything should be good, I would think. Yeah. I'm not hearing anybody saying anything to the contrary of that. When you're working in a state of emergency, in a pandemic, in all the different levels that we're working in right now, as long as you document, like you said, Wendy, I think that's what's important. The other thing that I was going to say, let's talk about something non-COVID. We could do that? Yes, we can. So we have a waiver renewal that is that our folks are working diligently on. And normally when we have a waiver renewal, we are driving around the state and we're having big town hall meetings, well, as many people as we can get to show up, and we're asking and answering questions, and we get all that done before we have to post for public comment, so that when we post for public comment, we have a really good idea of what to expect, and then we send this off to CMS. And the renewal goes into effect next July. That's July 1st of 2021, which means we have to have it to CMS by January 1st. And I know that that seems like a long way away, but in the world of public comment and doing business the way that we would normally want to do it, we are not that far away. So it's going to be a different process for us this year than it has been in the past. Stick with us, but please know we want your comments. We want your feedback. It's really, really important, and we need you all to be paying attention to that part of our world, too, because that's getting ready to change. I'm not sure when we'll get budget action items to talk through, but I will let you know. We'll put that on one of these calls as soon as that happens. And that is, are there any other questions from the Q&A, Gary, that we want to address right now?
So we had a question come in asking about the relief payments that you apply for directly, or those for direct or indirect payments like waiver. I think I know what that question means, so I'm going to answer it that way. We consider Medicaid waiver direct payments to providers because you're enrolled in the Medicaid system. That's where you enroll through. The payments made directly to you. The fact that it passes through DMH, I don't think is really a distinction that makes a difference. So we're considering you guys as receiving direct payments from Medicaid and qualifying for this, if that's what the question was.
All right.
And I think there was one other question. Is service monitoring still suspended? So I'm going to speak broadly to that, and Val can jump in too.
So updates on TCM face-to-face visits.
Yeah,
so
okay. So that we're working on. So we're getting together next week to kind of line out what we're going to be doing and how we're going to be rolling that back out. But service monitoring suspended in terms of, you're talking support coordination, that monitoring has been ongoing. It just has not been face-to-face. So there was no suspension or anything along that lines with support coordination. That has been ongoing and should have been on schedule, and it just wasn't face-to-face. If we're talking about monitoring in terms of PR and the business office and TCM tax, that's what we are working on, our plan for next week and how we'll start stepping back into that. And it will look different across the state, just like you guys opening up. And opening up day programs and getting back out in the community, it'll look different across the state too, based on where we're at.
Mm-hmm. No, I agree. One of the things that does concern me, and what I really want to try to figure out, is how do we re-engage in those face-to-face service case management monitoring visits, because I think that's a really, really important piece of our system. And 1 month I'm kind of okay. 2 months my heart starts to beat a little faster. 3 months my hands are sweating too. So we really need to try to figure out how we can do that safely. And again, it can be one of those things, like Wendy said, it's not an all or nothing. If we can do 5,000 out of 7,000 safely and more like we used to do it, then we should be doing that. But we have to look at the individual situations as well. And so it's really hard. It was really easy to shut it down. It's really hard to open it back up when you've got to take all those things into consideration. So, and that's what I want to make sure people think about. And another thing that Mark Stringer likes to talk about with us all the time is, as we're reopening, this whole thing is very dynamic. You have got to be paying attention to data. You have got to be ready to say, okay, in this county or in this region or in this metro area, we need to approach things differently right now. So it's got to be really dynamic, and you guys as providers and families, you have to be really dynamic too. I mean, we will continue to do our best to share all the data we can with you and to make you aware of what we see going on. But I just want to make sure you understand it's as much about an individual's it's as much about the individual and how they play into our system as it is about me just saying we're back to normal on July 1st, which it won't be back to normal on July 1st.
And this is Kim. There's a lot of good resources that we've posted out there. Emphasize planning, identification of individualized risk, the importance of ongoing communication with the individual and their teams. Everybody should just be having ongoing conversations right now and monitoring.
Gary, you want to read the question?
We got another question came in.
Asymptomatic positive staff work with positive consumers if willing and able.
We do not do that in the state facilities. If you are an asymptomatic staff, you are off until you are 2 negative back to work. And that means you have 2 negative tests back to work. That means you're 10 days, so we don't even start till 14 days after we know. And then you are 10 days, or 10 days symptom-free, 10 days no symptoms, 3 days no fever. Sorry, I get a little confused there. So if you've never had any symptoms, it's 14 days and we start retesting you to come back to work. So they are out of our, we do not let asymptomatic staff work, no. Partly because you never know when those symptoms are going to start. So, and there is little, we know very little, and I guess this could go back to the World Health Organization on Monday said asymptomatic transmission doesn't seem to be that bad, and on Tuesday, the whole world who has been dealing with asymptomatic transmission blew up, and then the World Health Organization retracted that statement because there, again, we know what we know, but there's so much that we don't know. One of the things that's really frustrating for us right now is when you've got a staff that is tested back with 2 negatives, and then 2 weeks later they're showing up as a positive, we think that they're likely not shedding live virus, likely not very contagious. We think, but am I willing to take that risk? I'm not yet. So we're still retesting them again and getting them into a negative status and then bringing them back to work. So there's just, you know what you know, but there's still so much that we don't know. So, and we do tend to err because we support so many really vulnerable people that cannot social distance, that cannot wear masks, that cannot do all the things that we need them to do. We have to really be cautious. But just to let you know, there's 422 people on the call today. And thank you. I know we have a lot of state staff on the call. I want to thank you guys for everything you've done to date. I will tell you on the regional side, it is starting to tick up. And we told you it was going to tick up. So far, you guys have definitely stepped up to the challenge and have been doing such a great job. Keep up the good work, but like we tell people, it's not if, it's when it's going to happen to you, and it's starting to impact us in all of our regions across the state at this point. So thank you to all the state staff. Thank you to all the families who have been following the rules. Clearly, we are good at prevention, or we would have more than 45 positive individuals in the community. So thank you to the families. Thank you to the providers. Thank you to the provider staff for all you're doing, and keep it up. We cannot stress enough the importance of screening your employees, the importance of social distancing, the importance of personal hygiene, hand washing, surface hygiene, and the benefits of wearing masks. And those can just be cloth masks, but we cannot stress that enough. So that's the last time today I'll preach prevention, but I'll do it again next week, so stay tuned for that. And thank you guys again for everything you do. Have a good weekend. Enjoy this beautiful Missouri weekend. Bye.